Dr. Nathan is a paid consultant by Arthrex Incorporated. A right rotator cuff repair is visualized from a lateral viewing portal in the subacromial space after an extensive bursectomy is performed. An anterolateral working portal is utilized to debride any remaining bursa with a shaver or radiofrequency device. And the soft tissue overlying the lateral footprint is removed. A basket forceps can be used to further debride the tear edges. An optional traction suture is shown here anteriorly. Once the soft tissue is removed with the shaver, the medial footprint is prepared with a burr. The bone bed is denuded of all soft tissue, as shown here. The spinal needle is then introduced to localize and improve the deadman angle of the medial row anchors, which are inserted both anteriorly and posteriorly respectively in this scenario where a 2x2 configuration will be used. A loop grasper is then introduced to retrieve one suture limb from the posterior medial row anchor. The suture limb is loaded onto a suture passer and then passed through the posterior rotator cuff. The loop grasper is then placed through the posterior portal, and the suture limb is docked here for later retrieval. This process is repeated 3 more times, moving posterior to anterior in alternating colors for suture management. Next, the process is repeated for the anterior medial row anchor suture limbs, again docking each limb after passage through the rotator cuff through the posterior portal. After passing all 8 suture limbs through the rotator cuff, the 4 limbs of the anterior medial row anchor are then docked through the anterior portal for suture management. The 4 limbs of the posterior medial row anchor are retrieved through the anterolateral portal as shown here, and then brought down to the posterior lateral row to judge tension and position for anchor placement. After loading the suture limbs onto an Arthrex swivel lock anchor or similar knotless anchor system, and all is introduced through the anterolateral portal, this will be the position of the posterior lateral row anchor, the anchor is shown here prior to insertion. After being placed in the appropriate position, each suture limb is tensioned according to tear size, tear shape, and tear mobility. Once this is performed, the anchor is screwed into place. An arthroscopic cutter can then be used to cut the remaining suture limbs in this knotless construct. The process is then repeated for the anterior medial row suture limbs. These sutures will be brought down to an anterior lateral row anchor, as shown here. After tensioning the sutures and screwing in the anchor, an arthroscopic cutter is used, and the final construct is then visualized.